As we think about this in a lot of aspects of medicine, implementation of these technologies can be really tricky. So, what's the evidence so far that these approaches actually improve outcomes or reduce hospitalizations? And where do you see the biggest gaps in really translating that data into clinical action and outcomes and benefits for our patients?
Absolutely. That's really important. I think the things that I think about most are those really pivotal trials that helped us understand, for example, the utility of the PA sensor monitoring. So we think about Champion and Guide HF specifically for the CardioMEMS device. Even more recently, we think about Proactive HF, for example, really showing that, hey, this is an intervention that can really help patients potentially feel better, potentially stay out of the hospital, and help to manage and identify patients who are getting congestion much earlier than some of the symptoms that we might otherwise know portend to poor outcome. But you mentioned a really important thing, Anna, and that is that the system is really important. We don't really get to, we rise to the level of our systems more so than the level of our goals. And so I think it's really important to have a system in place to understand what do we do with all this data. We're really very, very fortunate at our center to have a dedicated colleague who really helps us to understand what's this data coming back. How can I partner with either our nursing colleagues or our clinician colleagues to make sure that we are adjusting medications in the appropriate setting? And we really need to also use that data to understand that it's not just about decongestion, but also about optimizing all of the different methods of guideline-directed medical therapy in order to have the best outcomes for our patients. And so that does require a system that can be very hospital-specific to really take the best care of patients.
In a similar vein, AI is often described as a game changer in medicine. From imaging to risk prediction, its potential in heart failure is enormous. What are the most promising applications you see today, and what should clinicians really expect from AI tools in the near future?
That's a great question. I think there are so many AI tools that have just very practical purposes in our world in heart failure today. For example, at our institution, we're adopting the DAX Copilot, which actually can help to actually listen to the outpatient interactions and help to write the notes for you. So when we think about taking the best care of patients, a lot of that also means like taking away the administrative burdens that might exist. So from a very practical perspective, we have AI tools that we can use to relieve some of those administrative burdens and help us really think more critically about the patient who's in front of us. So I think from a practical perspective, that's really nice. And then when it comes to AI, we recently were very excited to publish in JCF this very nice artificial intelligence review, specifically in heart failure. And it does a nice job of thinking about what are the applications in from stage A to stage D. We know that stage A patients are identifying patients who are at risk. We can use artificial intelligence to, for example, identify patients who may be out in the community who have worsening diabetes or worsening high blood pressure, and how can we bring those patients in to access care? That's a really huge opportunity. And all the way to stage D when we consider identifying those patients. As we know, it can be really hard to identify patients who might be stage D, and they may be out in our communities and not really know it, and then come in, unfortunately, too sick and miss that golden window. So we need to use AI tools to potentially identify those patients using either large language models or the like to identify those patients, help them get in to seek care, and then ultimately, hopefully, get the care that they need. So I think the opportunities are really endless when it comes to AI. And I really also believe that this is a burgeoning field that's going to continue to change. I mean, it's going to look totally different in 2027 than it does today, which is really exciting.